Good evening, Destiny and friends. Good evening on tonight. As you can see, I am not Apostle Brown. My name is Patrice Horton, and I'm an elder at Destiny International Ministries, as well as a licensed clinical mental health counselor. For the month of May, Apostle Brown is allowing our ministry to highlight Mental Health Awareness Month. So in lieu of our weekly enrichment studies, we'll be engaging in conversations with a counselor to address various mental health topics. So tonight we're going to be discussing spilling the tea in trauma, and I'm going to be joined by my colleague Crystal Bullard, and we have a guest moderator for this evening. Her name is Elder Amy DeWitt. She's going to help us facilitate tonight's conversation. Before we get started, I would like to say that our discussion tonight is not a substitute for a therapeutic relationship with a licensed professional counselor. If you feel like you need to talk with someone, a mental health professional, please feel free to contact us and we will connect you with some counseling resources on tonight. Also, if you have a specific question that you would like for us to answer during our discussion tonight, please leave a comment in Facebook Live, in the chat, and we will try to answer that question. So without further ado, I have my colleague and I have our moderator on tonight, Elder Amy DeWitt. Good evening, Amy. How are you?
Good evening, Elder.
Great. So I'm going to go ahead and introduce myself, then Crystal can introduce herself, and Amy, we'll let you just go ahead and get started with the questions, okay?
Absolutely.
Perfect. As I mentioned before, my name is Patrice Horton, and I'm a licensed clinical mental health counselor in the state of North Carolina. I am currently a military and family life counselor at Seymour Johnson Air Force Base in Goldsboro, North Carolina, where I do support servicemen and their families. I also own a part-time private practice called Hope for the Heart Counseling Services, where I provide support and counseling to individuals who are dealing with depression and anxiety as a result of traumatic experiences they have encountered. So that's a little bit about myself. I'm going to go ahead and have my colleague Crystal introduce herself on tonight.
Hi, everyone. My name again is Crystal Bullard, and I'm a licensed clinical social worker, and I provide therapy for children, adults, teens, the family unit with a DSS, a local DSS in North Carolina, of course. And I have been doing that maybe about 4 years now. Providing therapy, being a support and a resource for those who are struggling with mental illness is definitely a passion of mine. So it is what I love to do.
Cool. Thank you, Crystal.
Yes, thank you so very much for those introductions. I tell you, it seems as though we have quite a bit of experience here tonight, and we're going to really enjoy the conversations with counselors. And I'll just pause for just a moment and actually let you know that I am currently a registered nurse with over 4 decades of practice, and I practice here in Raleigh, North Carolina as a health center administrator. And with that, I'll move forth with our conversations with our counselor.
Okay.
As I begin to approach this subject, conversations with counselors, I know in our communities, we're a little reluctant to actually reach out for any type of counseling. However, it's one term that I really like to focus on tonight, and that is trauma. A lot of us really don't know what the term trauma actually entails. So for tonight, I'd like for Patrice to actually give us a definition of what trauma actually is.
Perfect. Yeah, I sure will. So when we talk about trauma, and I'm going to give like a general definition. So trauma can be defined as a psychological, emotional response to an event or to an experience that's deeply distressing or disturbing. It can impact one's ability to cope and function in life. Also, I want to say something about trauma as well. It's pretty prevalent, right? So I was looking at one study, and it said that around 70% of adults in the United States have had some type of experience that would be classified as traumatic, or will experience something traumatic in their lifetime. And so a lot of people may encounter situations or events that may be traumatic. So it's pretty prevalent in our occurrence in our society on today. Sometimes also, Amy, the term trauma I want to throw this out. It does not mean PTSD, because sometimes people think those words are interchangeable, but they're actually not. We're going to talk about that probably a little bit later on tonight. So it's often used as like an umbrella term is what I would describe it. And to refer to, like I mentioned before, traumatic events, the traumatic event itself, or just extremely high levels of general stress in response to an event. So like I said, that's kind of my definition of trauma. I guess our working definition of trauma for tonight. So that's definitely kind of this psychological and emotional response to an event that's distressing or disturbing or frightening or scary.
So with that being said, Patrice, then it moves me to really think about, Crystal, would like for you to pretty much chime in on this particular one. Is it those individuals that cannot identify whether it is a traumatic experience or what have you? How do we go about, what do we do as a community or as an individual, or for that reason, as a parent? What do we do, particularly when they are adults? How do we handle that when they can't identify that it's really a traumatic experience? What will we begin to see? What kind of symptoms will we begin to see?
Okay. So I want to kind of separate a little bit because it can look a little different in children versus in adults. A lot of the symptoms can mimic each other, but sometimes there are some slight differences with children. So with children, you may see some regression. They may be doing things that isn't developmentally appropriate for their age. So you may see some bedwetting, you may see some clinginess to an adult or to the caregiver. You may see even a loss of control with bowels. Those are some things that you may see. Some things that may be more general to both populations, adults and children, would be, it could be not eating enough. It could be changes in appetite or eating too much. It could be changes in sleeping too much, not enough. Definitely irritability and mood shifts. I'm not gonna throw it all out because I want Patrice to chime in too, but those are just some differences and similarities that you can see within both groups.
Yeah, thank you, Crystal. That was really good, and you I think you nailed it very well in terms of like the stuff that happens in children. Oftentimes, I've also seen, especially when I was doing community mental health, children who may be experiencing something traumatic. Sometimes it can be looked at as, oh my gosh, does my child have ADHD, because they can have difficulty concentrating, or they may be hyperactive at times as well. So sometimes it gets misdiagnosed as ADHD, but it's really that they may have experienced something traumatic or a symptom of the trauma they experienced. Like, so hyperactivity, difficulty concentrating, sometimes like zoning out or spacing out. I hear parents say. Sometimes children also experience somatic symptoms, such as they'll complain about a stomach ache or headaches, things of that particular nature as well. And you've already mentioned the regression in terms of toilet training. Sometimes there can be things like regression in language loss, or regression in motor skills, like they might have been able to button and tie and do certain things like that. But sometimes you may see some regression in those areas as well in terms of children. Sometimes, as you mentioned, they can definitely be more clingy to their caregivers, but also sometimes they can be more distant and withdrawn from family members as well. So in terms of, those are some of the distinctions that I would say also, just to add to that piece in terms of children.
I want to add a little piece too. We talked about, the younger children and adults. I don't want to forget the adolescents, because sometimes we can see some things with them as well. And so for teenagers, you could see drug use, alcohol. They start doing those things. It could be a lot of risky behaviors. It could be promiscuity. Those things can often be signs of trauma as well.
Thank you so much. As you were talking, I thought about it, particularly with children. Is it a particular age that you actually would recognize it more so, a lot sooner than you would with others, or is it an age that it pretty much dominates in? Either one of you may.
I'll chime in right quick, and Crystal, please feel free to add. I don't know how much I'm going to say about this subject, but I know in terms of trauma can happen before kids develop language, right? So it doesn't necessarily, they can experience something traumatic or they can witness something traumatic. So when we talk about trauma or being traumatized, sometimes it's not necessarily something directly happening that's happened to the child. It could be something that they witnessed or observed. Oftentimes what I've seen with children, so it could be things like they witness intimate partner violence or domestic violence, or they saw something scary happen to a loved one, and they become traumatized. And the thing about it is, so sometimes trauma can be pre-verbal before they've developed language. And then sometimes it can be after they've developed language. So it just really just depends on the situation. So it doesn't necessarily, trauma can happen to any of us at any point in time in our lives. So it just depends. I know in terms of if we're going to go into like DSM-5 and diagnosing like the PTSD, I think what they have us is like 6, the criteria that for PTSD is usually, I believe, 6 and up. But then they do have some information for if someone is younger than 6, what it might look like. But trauma can happen or we can experience or observe something traumatic at any point in our lives. So I don't think there's a particular cutoff or a particular age, but I think there's ways to kind of go about treating, and then ways to go about maybe diagnosing, as you would say, if that's necessary. But Crystal, I'll let you add to that.
I don't really have too much to add. I was just gonna say also that it definitely happens in any age, infancy all the way up to the oldest adult. We can all experience a trauma or become traumatized. And in my experience, there's really no way to say what age, way to detect it other than really just knowing the symptoms, and just approaching, changes in behavior with curiosity, because Patrice said earlier, oftentimes children are misdiagnosed, and they easily can get the label of ADHD when a lot of times it's not the case. Because if you think about it, if a child has been, in an abusive or neglectful environment, or, where their needs are not being met, it's a lot of fighting in their environment, they're not resting well, it's going to be hard for a child to sit still. Like, you're going to be fidgety too. You're not going to be able to really focus and concentrate. But it's easy for us to say, oh, that's ADHD. No, not necessarily, So just knowing the symptoms, being watchful, approaching what you see with curiosity, those are the best ways to be able to determine or identify, and this may be trauma.
Mm-hmm. Okay, with that being said, thank you very much for those comments. I'm learning something myself here this evening. Thank you so much. So with that, I'd like to know, when should you actually seek treatment? What point do you get to that you really need to know that treatment is indicated?
I'll go first on that. Yeah. Whenever your life is disturbed, like your ability to function, your ability to complete tasks that you usually complete, when your relationships, your work, your day-to-day activities are suffering, when you are living in a constant state of whatever the event was, whatever the trauma was, when you are constantly in that space and nothing else is getting your attention, those are some indicators that I may need to reach out for some help. When you're not sleeping well and it's recurrent, when you have those racing thoughts and your mind is always again on that traumatic event, when you realize that you're spazzing out on the people that you love or you work with, and it's without reason, those are some telltale signs that I may need to seek out some help here.
So when I'm sitting, wringing my hands and just shaking my knees and what have you, is that a clear indication that maybe something is possibly wrong? because as adults, sometimes we need to be more observant and to really see. But if we're actually struggling with the trauma, have been traumatized, then are we a little reluctant to actually reach out to the child or seek treatment for that child? Have you seen any cases with that, Patrice?
So yeah, I think it's interesting that oftentimes I have seen that parents are actually more apt to kind of reach out for support for their children and maybe not themselves.
Mhm.
And so I've seen where parents will come in and they'll want treatment because they may be describing, or it may be disclosed at some point during an assessment, that the child has experienced or witnessed something traumatic. And they'll be like, okay, I want my child to come and get help. And most of the time, what I've seen, it's not necessarily that the person is coming in per se because of a traumatic event. Oftentimes, especially when we look at adolescents or younger children, they may be coming in because they're experiencing like anxiety, some extreme anxiety. For adolescents, it may be some depression and anxiety. And so people will come in and they'll want treatment for their children based on like depression or anxiety. But once you start to do an assessment and dig a little bit deeper, have that curiosity that Crystal mentioned, you'll actually uncover or discover that there's a root to where this anxiety started. There's a root cause or beginning to where the depression started, and a lot of times it's based in trauma. And so I've seen where parents will come in and they'll want their child to receive some type of treatment and care, and not really be aware of what how has this trauma impacted you, the thing that you went through. Because sometimes, like, I've seen kids who've experienced domestic violence, and the parent, is not even really aware fully of how just the domestic violence they personally experienced, how this impacting them, their parenting, but also how it's impacted the child. So sometimes I'll say that the opposite, that the parents do want to get help for their kids, even if they don't even recognize that what they've gone through themselves is something traumatic, but they'll want help for the kids. And most of the time it's not necessarily coming in because of trauma per se, but it's other things that get them through the door. There's other situations, like if they feel like their child all of a sudden has some ADHD or is experiencing something that maybe they weren't before. So oftentimes other types of symptoms may get them actually in the door, or may lead to the parent reaching out for services. But as we continue to do assessments and as we evaluate and as we gather more information, at that point, we kind of determine, hey, there's something that's happened that's causing little Johnny to display these particular behaviors. And it's going to be helpful if the treatment includes some type of trauma type of treatment, or we're going to look at this through a trauma-informed type of lens. So hopefully I answered the question, but oftentimes they will come in and they'll want their children to get help, even if they're not wanting the help for themselves.
Okay, thank you so much. In all of your treating, Patrice, do you think trauma affect everyone the same?
Well, I will say this, Miss Amy, no, trauma does not impact us all the same, right? And I say that because one of the things that may influence how trauma impacts us is our past or our history, right? So for some people, if they've had, a relatively stable upbringing and environment, and they experience something traumatic, and depending on how their community and their family, rallies around them, their experience with the traumatic event may be different from someone else who already has maybe a history where there's already some instability, some neglect, or something early on in their childhood that this happened to kind of trigger that. Then that can kind of cause the other person to respond differently to something to a trauma. So, for example, I was working with a young lady. This has been some years ago, who lived through. I don't remember which flood it was. But she had to be rescued. She was living in Eastern North Carolina at the time, and their family had to be rescued from that particular flood by boat. And so every single time there was any inclination that it was going to rain or some type of storm, this was something that was very triggering for her. So she would pack up her bag. She would like, okay, she would become very hypersensitive, very alert, very fearful, and very concerned, about the storm. Are we going to have to be rescued? So she would just already be looking out for danger. She'd be very vigilant, hyper alert to any type of storm, any type of weather type events. And so I say that to say that no, we don't experience it the same. And part of that is kind of dealing with our history before the trauma happened, and also how what happens after the traumatic event. So just say something like sexual abuse occurred, and the child who may have shared this to a parent, the parent didn't believe them. And the parent was like, no, you're not telling the truth. I don't believe you. And so that is going to impact how that child experienced the trauma versus someone who experienced something traumatic. And the family does believe them. The family does go ahead and seek out some help, does rally around them. So I think what you do after the trauma and what's happened before the trauma also determines how you experience that traumatic event, if that makes sense.
Okay.
And
So
Crystal may have some other things to add to that as well.
We're really on the same page. My answer to that, like you, is no, it doesn't affect us all the same. For some people, I think Patrice mentioned it earlier, at some point with the statistic that you share, we will or have all experienced some trauma. And with that, some people who experience a trauma will just roll on, bounce back, same day, next day, and keep it moving. Some will, experience some distress. And again, I think Patrice mentioned this earlier, the symptoms will dissolve rather quickly. And then others, is a totally different ball game. It affects them much like the client that she shared about. You're living in a constant state of fear when you're reminded of, or when you're triggered by whatever that traumatic experience is. So you're always alert and looking for it. So yeah, and also, and this is probably echoing again what Patrice said, it points a lot towards also those protective factors and risk factors that you also brought out, how we were raised, our environment, what our support system and connections look like whenever we were growing up. Because based on that, whenever we experience a trauma, that's what's going to shape our worldview, how we now see ourselves, how we see the world, and how we see others, based on that upbringing and what happens, again, like Patrice said, like before and after the trauma. But no, we do not all handle it the same.
We have to remember that we're coming into this with already a lens and a way in which we view things.
Absolutely.
Right? And so if your lens has already been distorted, or your view or perspective has already been distorted because of prior history of trauma or instability, or something that's happened, then that's then that's definitely going to shape how you also, as Crystal said, experience that traumatic event, or how you respond or react to that particular traumatic event. So I was thinking also some things also, like she said, family, community, the history, our caregivers' reactions if it's a child. Sometimes also things like proximity to the event, right?
Yeah.
In terms of, was the child actually there to see something traumatic? Was it something that they was told to them, or something they or heard people talk about? And then sometimes it can be the severity of the traumatic event itself as well.
So I want to understand this. Does someone have to experience a traumatic event to be traumatized? Do they, Crystal?
Yeah,
absolutely not. And I think we've kind of pointed to that as we've gone along. You don't. And so, there's a vicarious trauma or secondary trauma that is a real thing. So to kind of take it out a little bit more. So those of us who work with trauma patients, or first responders, EMS, paramedics, volunteers who are, going into the aftermath, even we can use Ukraine and Russia, what's going on over there, those persons who are over there helping and, lending a hand, seeing the aftermath of things, or constantly hearing about someone else's traumatic experience, hearing those details, it can cause someone to honestly step into that place. And it can be the same symptoms and experiences that the victim is experiencing. You can begin to experience it as well, and kind of take it on. That it doesn't have to always be that way, but it is a real thing and it can happen. So you don't have to directly experience it. Patrice said earlier, it can be just witnessing it also.
Mm-hmm. Yeah, witnessing it, or either just hearing people like in our role, just hearing people talk about traumatic things over and over, day in and day out.
Yeah.
As a counselor, you can experience that secondary trauma where you begin to experience emotional distress, right? From what you've witnessed or what you've heard over and over and over, because some of the things that people disclose to you, I mean, these are some egregious types of things that have happened to them, or some scary things that have happened to them. And so, being able to sit there and hold space for people to share some of their pain, that can also impact you. One of the things that I make sure I do not do, a lot of times that we see, because of social media, things can be broadcast over and over. I don't watch those tapes, those videos of violent things happening to people. Whether it's, police brutality or, whatever it is, I don't watch that stuff because I don't want to have that, in my mind, resurfacing. So I'm very careful about what I take in, even in social media, and on the news and those type of things. I don't watch those videos. I mean, a lot of times they give you these warnings, like trigger warning or warning, this is disturbing information, disturbing to watch. I don't watch it.
You know what? Thank you so much, Patrice, for actually bringing that to the forefront, because as a human, we have emotions as well. So I'm glad that you brought that out, to know that it also can impact you as the counselor. So you have to draw the line and be able to handle it in a different manner. So I really thank you all for the information, but now I think it's time that we find what are some helpful and non-helpful ways to respond to someone dealing with trauma. Okay, I think I'll go with Patrice on this one.
Okay.
What do you think?
All right, I'll start off. So I think that one of the things I'm just going to throw out there is that it's not always easy to know how to help after a traumatic event, but I'm going to share some few ways. And first, I'm going to share just like some general kind of practical like things to say versus things not to say, right? To someone. So some things that you might want to consider saying is something like this: I'm here for you, or how can I help you right now, or thank you for trusting me to share this, or things like I believe you, or I believe in you, or I'm here to listen, or you are loved, right? So those are some things you might want to consider saying. So these are some things you want to avoid, comments you want to avoid saying. Dismissive comments like it wasn't that bad, or just move on, or you're lucky, and look on the bright side, it could have been worse, right? Or some assumptions like I know how you feel, or it's all in your head, or judgmental statements like you shouldn't have done that, or you shouldn't be angry. So those type of things are comments you probably want to avoid saying. But in general, you just want to support them by listening, right? You want to be doing some active listening. You may not be doing like a lot of talking or comment. You just let people know that you're there, being present with them, or being present with them. Also, when I say being present with them, without any expectation, they share what they want to share. It could just be just sitting, right? And then support their need for space. So some people may need space in that moment. And also I want to be cautious of light touch. So some people, especially who have had traumatic experiences around the body, sexual abuse or sexual assault, they may not want you touching them, right? They may not want that hug. Right. So you may want to be careful about how you just, going up and approaching people and giving them giving them hugs or being in their personal space. And I just say, be patient. Another thing that I think of is just offer to help out with just routine tasks, because individuals who've experienced something traumatic, they have that difficulty concentrating or focusing. So just offering to help out with just routine tasks could be a support. And also, especially if you're living with a loved one, or you're, in a helping role, practice self-care, right? You got to make sure you take care of yourself too, if you are being in that supportive role of someone who's experiencing something traumatic. So though that, that's my share in terms of ways that we can help people versus unhelpful things we can do and say.
Thank you. Thank you. Crystal, would you like to add?
Sure. Patrice did share a lot of the ones that I thought of, but when someone has experienced a seriously traumatic event, when you think about it, something like sexual abuse or physical assault, right? It takes a lot of courage for them to disclose that to someone. Mm-hmm. And so being mindful of that and remembering that being okay with silence. Mm-hmm. A lot of times we are uncomfortable with silence. And I used to be one of those people. I felt like you got to fill the space with something, but you don't. You really don't. Sometimes there's nothing that can be said or that needs to be said. So being okay with just sitting with them. Sometimes that's all that's needed, just to sit with them. You can say something like, it must have taken a lot of courage for you to share that with me. Or, you did what you had to do in the moment to survive. I'm sorry that happened to you. How can I support you? All of those things. And remembering that it's not a time for you to put your advice out there or to become curious and start probing them with questions. That's not what you want. Not what you want to do. And I like to always say to try to put yourself in that place. Some things, no, we haven't experienced, we can't relate to, but we've all experienced something that was awful at some point in our lives. So if you can just think on that, like, what did you need in that moment when that awful thing happened to you? What did you want someone to say to you? What did you want someone to do for you? If you can step into that place and respond from that place, that would be very helpful. What not to do, don't minimize what they share with you. Mm-hmm. Be mindful to not be invalidating. We want to validate, that their emotions that they're, expressing, and not try to compare like that's something that we try to do. Well, that happened to me before, and I didn't feel that way, or I didn't respond that way. Or someone's having, panic attacks because they're triggered by whatever. And you say, I know exactly what you mean. I had a panic attack when I saw my light bill. Now, come on. Like, there's no comparison there. But we do those things. And sometimes our heart is in the right place. We're trying to do the nice thing, but out of ignorance, it's an epic fail. So, just being mindful of that, not trying to compare them to you or to others, and just to approach it with as much empathy as you possibly can.
Mm-hmm. Yeah, that's really good.
Yes, it is. Thank you, ladies, so much this evening, Patrice and Crystal, for conversations with a counselor. And as professional counselors, we always need to know where our resources are. Do you have any particular resources that you can actually deliver to the community that if someone actually need a counselor? Of course, I know you both in the profession, however, what are some resources that you can provide, information you can provide to them?
Yeah. So there are lots of resources, and I'll just throw out some. I wish I had some typed up. I probably have them somewhere. So if you're looking for a counselor, there are lots of different online types of directories that that people use when they're looking for counselors. Like I'm on Psychology Today is one of them, where you can
Yes,
actually
you
just
are.
put you can put your zip code in, or you can put your city in, and it'll pop up lots of different therapists. If you're looking for a clinician of color in particular, there's Therapy for Black Girls is an online directory, as well as Therapy for Black Men is one of those online directories. There are lots of them. If you are just looking for like a local kind of government, there's Alliance Behavioral Health, which is a MCO or in this area. You can call Alliance Behavioral Health and let them know you're looking for a counselor, and they can find you a counselor, especially if you have things like Medicaid or Medicare or those type of insurances and you're looking for a counselor. Also, I tell people your insurance company, right? So if you have insurance, you can call your insurance company, because they should have a list of providers. Oftentimes they're on the website, just like you can go to the insurance company and find a doctor in your area. There are also mental health professional directories on your insurance company. So you can contact your insurance company and they can do it. Also, if you don't know anywhere else to start, I tell people you can just start with your primary care physician, right? Start there. Oftentimes they have connections with therapists in the area. If not, they're pretty good. They will do the work for you. They'll start doing the research and they will say, hey, because I've had several reach out to me to say, hey, I have this, this client, this is what's going on. Are you accepting new patients? And so I'll just, send them an email or call them back and let them know my status. But if you don't know anywhere else to start, you can always just start with your primary care physician. Also, if you feel more comfortable with your church, you can start off with your pastor. Oftentimes churches will also have, pastors or leaders will have referrals, or they'll have like a list of counselors who maybe they vetted that they can also refer congregants to as well. So those are just some ideas of where you might want to start. Those are the ones I can think of off the top of my head, but Crystal, please feel free to share some additional ones that I cannot think of.
No, I think you hit
You're pretty
the primary ones.
Yeah. Yeah, the main thing is just get some help, right? Don't, if you are experiencing any type of psychological or emotional distress, as Crystal said, that's impacting your functioning at work, at home, right? Impairing your ability in some way, it's okay. And sometimes if you just need to talk to someone, I think sometimes people think that if I go see a counselor, it's because I have mental illness or mental health issues. I will say counseling is also just for just regular stressors, right? You're overwhelmed, things going on at work. You don't have to have a mental health diagnosis to see a counselor, right? They'll let you know at the assessment whether or not you have one, right? If you have one, then you can use your insurance. If not, you may have to pay out of your pocket, but you can still see a counselor, right? You can still see a counselor, and so I'll just say, just get the help, right? Don't be afraid. We have to start to let go of some of the stigma and shame around seeking help. I think being able to seek help and to say I need help is a sign of strength, right? When you're able to admit that, I'm struggling right now, and it might be good for me to talk to somebody, because maybe the thoughts that I'm having may not be, the best type of thoughts or helpful thoughts. And so it's important just to say, let me just give this thing a try.
Yes, thank you so much. I tell you, because I think early on I mentioned the fact that there's so many stigmas attached to particularly our community, and it's time out. Mental illness is real, and you know what? I'm no longer embarrassed. You have to take a stance that I'm no longer embarrassed. A therapist need a therapist, okay?
Exactly.
So we need to recognize, reach out, get help, seek help. Seek help without any remorse or anything, understanding that your mental health is just like your physical health. Absolutely. And you must take care of both of them. And I want to thank Patrice and Crystal for valuable information that they brought on for us today. And I hope that it will enlighten some individuals that they would reach out and seek help without embarrassment being the first thing that they think of. And thank you, ladies. And
great. Yes, thank you so much, just Amy, for allowing us to help drive the conversation and facilitate the conversation on tonight. I'm not sure if there are any questions that anyone has in the chat in terms of Facebook. I'm going to take a look right quick and to see if there are any questions that I'm able to see. I'm going to take a look right quick. Okay. So I figured I can't probably do that while I'm live because it'll pop up. But okay, all right. So there are no questions. I want to thank you guys for joining us on tonight for another episode of Conversations with the Counselor. Tune in next week as we discuss. We're going to continue the conversation with trauma, but we're going to be talking about intergenerational trauma, right? Trauma that kind of goes through multiple generations. So we're going to be having a conversation with another counselor to dive into that particular topic on next week. So we ask that you please come out and join us as we continue the conversation, knowing that your mental health matters, right? I like to say, if you don't have mental health, you don't have health, right?
Right.
So our mental health and our mental well-being or emotional well-being is very crucial, just to every aspect of who we are in our lives. So thank you, Crystal. Thank you, Amy. I'm going to move forward. I know this is not our traditional Bible study night, but we are still going to, we're still going to do our appeal for our offering tonight. So I'm going to get the various ways that you can, provide, the various ways that you can give on tonight. Let me go ahead and mute. All right, let me go ahead and, all right, perfect. All right. All right, so the ways to give are on the screen on tonight. And if you are giving to, if you would like to give to our ministry, you can definitely do that. Go to destinyinternationalministries.org and click on the link that says online giving. If you would like to be a blessing to our apostle, then you can sow a seed into her, and her cash app is Arise and Soar, or you can Zelle her at Shirley or Brown at att.net, or PayPal, Arise and Soar 2020. Again, we thank you for joining us on tonight. Please feel free to sow a seed on tonight. If you would like to give directly to our ministry or sow into our ministry, you can simply visit our website at Destiny International Ministries, or destinyintministries.org, and click on the link that says online giving. Also, you see the additional ways to give and to sow into our apostle. They're on the screen, which is Arise and Soar, Shirley or Brown at att.net, and Arise and Soar 2020. Thank you again for joining us on this evening. And we just say that we pray that you just enjoyed something or something that was said that was a blessing to you on today. So thank you for joining us, and have a great evening.